Preeti. You're audible.
Yeah, it's wonderful, Dr. Rakesh, to see you even if it's virtually. And thank you, Kamineni Institute and Dr. Rakesh and the rest of the department for including me in this conference. And it's been a very illuminating two presentations that I have seen so far. I like them very much. And Trisandhya has, I think, incorporated almost all types of treatment modalities and very aptly explained how different researchers have found differences in application for different types of appliances in different types of conditions. I think she has explained about almost all the appliances, at least touched the names and briefly talked about their applications as well. I think the only thing I would like to add is maybe nasal pillows, nasal strips and valves are also have also been tried, but of course the success of each of these appliances varies from person to person because the cause is different for each individual. And though literature says that there's not much use of drugs, some people have tried medications like topical corticosteroids, modafinil, proptyline, but not with much success. So yes, most of the treatment is, I think, the diagnosis means you have won the battle at least halfway through because it's a difficult, entity to initially diagnose. And secondly, I think appliances do have a large role to play in the management of this. Personally, I have two friends who are residing abroad. Both of them are using oronasal masks, and they have, I think, 95 to 97% improvement in their sleep apnea condition. So with that, I just want to hand it over back to Dr. Rakesh and the rest of you.
Thanks, Professor Preeti. One of the things which we faced, I mean, the standard which we often resort to is CPAP for these patients. And actually, I learned from you once when one of our patients, long distance patients, went to you and then you gave them the option of mandibular advanced devices. So I have been, using this option quite often. And for the first time here, we had our postgraduate student who was quite interested. And it appears that she spent a lot of money, about 40,000 for this thing which she built.
No, sir.
So
no, sir.
I was quite.
No, sir. Actually, the market price is 40,000, sir.
Okay.
The orthodontics department and the PG, they themselves designed it and gave it for free of cost.
Okay, so they designed it and made it with a much lesser cost. So that's even great. So
Yes,
how much did it cost you for that?
Sir, actually it doesn't cost anything. It is that we have to make all the appliances for that. It just takes a time.
Yeah,
That's it, sir.
I mean, the
one I have-
appliance cost in the sense the raw material, how much is it? Because if it is.
The college usually provides us material, sir. We don't spend anything.
Yeah, the college has to bear the cost, but how much is the cost of the raw material? Just an approximation, maybe.
Can you just tell him the cost of the acrylic, the wires, and the
Around,
yeah, basically the approximate cost price to make it. I mean,
around
maybe
4 to
3,000?
500, that's it, sir.
Yeah.
Around 4 to 500.
4 to 500. That's amazing. So yeah, I was actually bothered and worried that if I have to get my patients to pay 40,000 to buy this, then
Yes,
the
sir.
very
The one
purpose
I
of
have showed you, the appliance name is Oasis, which is fabricated by the Max Dent. It costs around 28,000 with GST, sir.
Okay.
I've showed it in the PPT.
So in the market, it's very expensive because these patients are trying this because they could not afford a CPAP device. Even the renting and all that costs a lot. On the other hand, if you say that somebody can make it in 400 to 500 rupees, that's a huge boon for this population who can. And I believe you have couriered it to the patient because it was a long distance